remember, as you push, the most important thing to do is to get the head of the baby underneath the pelvic bone. As you push, sometimes you will push a little and baby's head will come down some and then it will pull back up. And it will come down some and pull back up. Make sure you are pushing so strong that you get baby's head to come down under that bone. And the moment it hooks under that bone, it won't do what is called turtling back and forth. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi, and today we will be discussing the second stage in a three-part series of labor and delivery. If you have not done so already, make sure you go back and watch the first stage so that you catch up on the information you need to better understand the laboring process. Now, there's a very vital piece of information that I left off in that previous video. If your water breaks before you get to the hospital, make sure that you write down what time your water breaks. It is important for your nurses and your doctor to know this very important information so they know how long your baby has been exposed to the outside environment. This will help to time your labor correctly so that they know when to intervene and how much intervention will be needed. In today's video, I will be talking about what happens between 10 centimeters of dilation and when the baby is born. Many women wonder what 10 centimeters dilated looks like. I am going to offer a little bit of illustration here so that you can understand what your nurse means when she says you are fully dilated. If you consider the lid of this A&D ointment, the diameter from here to here is about 10 centimeters. Now, looking at this lid, you can tell that a baby cannot easily pass through this space, and that's why a woman needs to work as she delivers her baby. The second stage of labor and delivery is further broken down into two phases. The first phase is known as the pelvic phase, and the second phase is known as the perineal phase. During the first phase, a woman is allowed to do what is known as laboring down. This is very important, especially for first-time moms. When you labor down, the tissue, the cervix, is given enough or ample time to stretch and relax. During this stretching and relaxing process, even though you stretch 10 centimeters, your tissue begins to give way and soften up and spread in a way that you will not experience a lot of tearing or damage during delivery. You may also hear your nurses talk about the station of the baby. Station is just a nice way of saying where the baby is located in relationship to the pelvic bone. The closer a baby is to the pelvic bone, the more you begin to hear positive numbers. We want to stay away from the negative numbers, okay? So make sure that you position yourself, or you work with your nurses to be positioned in a way that allows gravity to work with you and cause the head of your baby, or whatever the presenting part is, to come down nicely into the birth canal. Now, as your baby begins to engage itself with the birth canal in the pelvic region, the more a woman begins to feel a strong sensation to push. Your contractions at this point are coming maybe 2 to 3 minutes apart, but they are still lasting about a minute to a minute and a half each. There are some factors that will influence how long this phase lasts during the second stage of labor. The head size of your baby is a very important factor. The larger a child's head is, the more difficult it is for it to engage and lock into the birth canal. Also, if your contractions are not strong enough, it may take longer for your body to accomplish something than if your contractions just came in and did the work and you use that strength and force to engage the baby. If the presenting part of the baby is the bottom, it can also be tricky to get that part to engage so that baby can begin to come underneath that pelvic bone to be born. Once baby has come down enough and has engaged, or your nurse or doctor checks you and they begin to feel a presenting part that has reached a certain station, it is time to push. And this is where the perineal phase of stage 2 begins. Now, when you get ready to push, there are many different positions that you can push in. A lot of women here in the United States push lying straight on their back with their heads curled toward their chin and their legs pulled up towards their chest. And a lot of times they will put you in what is known as stirrups so that your legs can stay up strong and not be in the way. It also helps to open the pelvic region to maximize the amount of room that baby has to come down. Another position is sitting on a birthing stool. A lot of women sometimes want to squat. Some women want to lie on their side in bed. And lying on your side helps you so that in between contractions or in between pushing, you can actually rest and catch your breath. There are some factors that can influence how effective a woman is when she pushes. The biggest one is if a woman is medicated, there's a chance that she may not feel that strong urge to push. And a lot of times when women are medicated, when they do push, they don't push well because they don't know where to focus that energy so that they can get the baby born effectively. When you get to the pushing phase, make sure you use your muscles in your bottom and not in your face. I see a lot of moms, or I've seen a lot of moms in my practice, put so much effort in their facial and neck muscles that they end up hurting themselves, getting a headache, hurting their necks, and their pushing is still not effective to get the baby to come down. When you push, make sure you put in your mind that this is something similar to having a very, very hard bowel movement, like someone who's very constipated. You want to make sure that you hold the backs of your knees and push very hard towards your belly button into the vaginal area so that you encourage baby to come down. Remember, as you push, the most important thing to do is to get the head of the baby underneath the pelvic bone. As you push, sometimes you will push a little and baby's head will come down some and then it will pull back up. And it will come down some and pull back up. Make sure you are pushing so strong that you get baby's head to come down under that bone. And the moment it hooks under that bone, it won't do what is called turtling back and forth. Once baby engages in the birth canal and begins to present, that's when the real show is, it's about to go down. For women who have had babies before, there usually is a better understanding of exactly how to push. But for first-time moms, it may take a couple of pushes before you understand fully what you are to do. Either way, your nurses will be there to guide you. And if a nurse sees that your pushing is not effective, they may want to change your position to see if you use the right groups of muscles in a different way, okay? If the amount of space available for baby to come through is kind of small and the doctor thinks it is best to help you along, he or she may perform what is known as an episiotomy. Now, an episiotomy is a simple incision into the birth canal so that the space can be extended. Sometimes they can just do a simple cut to stretch the skin a little. Sometimes they can cut all the way through into the anal area so that the baby's room can be maximized. If an episiotomy is chosen, it is a safer option than for mom to tear on her own. Try to imagine which one would heal better, a tear that is jagged or a clean cut that the doctor can go in and stitch very neatly. Of course, the clean cut will stitch better. So your doctor who is helping you, or your midwife or the nurse who is delivering this child, is very mindful of the amount of space that baby has and is working with you to ensure a favorable delivery. Once your baby's head emerges out of the birth canal, the doctor now will work with you to make sure the rest of the baby is delivered very smoothly. You will feel the doctor turn the baby in a way so that one shoulder will pop out and then the other shoulder is rotated out. Your baby will then be suctioned, mouth and nose, and at this point an umbilical cord clamp will be applied, and the doctor will either cut this cord by him or herself, or if your partner is in the room and would love to cut the cord, then this opportunity can also be offered to them. If you want to do delayed cord clamping, and a lot of moms want their baby to stay connected to them just to get that last little bit of blood and nutrition from the cord, and that's fine. Just make sure you discuss this with your practitioner before you get to the delivery room so that plans can be made ahead of time and this can be put into writing. The delivery of your baby marks the end of the second stage of labor and delivery. Congratulations, mom, for a job well done. Welcome to the world, baby, and happy birthday. If you have not done so already, make sure you hit the subscribe button and turn on your notification bell so that you are made aware of when I upload videos. And then share this video with somebody who you feel can benefit from it. If you have learned something, don't forget to give me a thumbs up and come along with me as we build this community of learners. Stay tuned for part 3, which concludes this 3-part series of labor and delivery. I will see you all in the next video. Until then, be blessed.